Continuing on the previous factor, this is Dr. S. M. Goel, MD Medicine, DM. I'm from US. I'm in US for last 30 years in the US, but I'm the youngest of the four brothers. We went to medical college from, in All India Institute of Medical Sciences and Delhi University colleges, which every Indian knows are the top medical colleges. And so, so I'm talking about the risk factors for the heart. Genetics, on which we have no control, is only 10%, but 90% is under our control. So if we are aware of them and we manage them, we can really keep our heart healthy. And and then heart is something we can make us lose our life in 5 minutes. And trust me, after age 50, heart and cancer are two most important things we have to worry about. And maximum research and advances has been made in heart health and in cancer research. And we have dramatic achievements. So fifth factor is high blood pressure. So I keep saying we have there are certain parameters in our bodies. If we maintain those parameters, we can really have a very healthy life. Parameters means we are active, we sleep so many hours, and then our blood pressure, this is our healthy, normal blood pressure, normal blood sugar, normal liver function, kidney function, cholesterol, uh, our all the our blood chemistries, they are highly controlled, well maintained, and nothing dramatic happens. So all the top medical recommendations are that you should do all the gold standard blood test once a year. And in this day and age, if those parameters are normal and compared to past, they are normal, you are in good health. I mean, health is more than blood chemistry, but blood chemistry is very important and reflection of your well health. So high blood pressure is we have to have maintain normal high blood pressure, which is in our grown up years 120 over 80. I mean the upper level of blood pressure when heart pumps, blood pressure goes up to 120 in a normal sitting stage. And then when it relaxes, it doesn't go back to zero. It comes down to 80 millimeter of mercury, and this is how it contracts, relaxes, and with each beat of the heart, blood pressure goes up and down. Systolic, matlab when it pumps, blood pressure goes up. Diastolic, when it relaxes, it fills with the blood and blood pressure comes down to 80, you see, and this cycle continues. So our body, our heart, our body, this is the best blood pressure for our body. If blood pressure is too low, we'll pass out, and if blood pressure is high, then actually, when we say high blood pressure, usually it happens very, very slowly, so slowly, and body keeps changing, keep adjusting. You have no symptoms whatsoever. I mean, you have no symptoms with diabetes, you have no symptoms with blood pressure, no symptoms with cholesterol. You just have to know it. Uh, so you have to understand that. So with the high blood pressure, it has a dramatic negative consequences over the years, slowly. You suddenly have a high blood pressure, hey, you will have a stroke. I mean, and this is what I, tell people if they are taking medications for high blood pressure and they can taking for, they should not skip it for 1 or 2 days because then suddenly blood pressure will jump up and it can really cause a bleed in the brain or a heart attack. So things happen, especially when you forgot to take your medicines or when you're traveling. But you have to remember that actually, if you're very regular taking your medicines, better not to take it. Your blood pressure rises very, very slowly. I'm not saying that your health will not affect negatively. A body cannot Body cannot handle that. You take medicine, blood pressure normal, then you don't take it, blood pressure jumps up, then you take it, and it comes back to normal. That is a disaster for our body. No, no. So, but high blood pressure will lead to heart failure eventually. Absolutely. All these studies, meta-analysis, supercomputer have shown even 1 millimeter of high blood pressure will cut down your life is 1 year. Hey, this is the data. This is statistics and average blood pressure. I mean, so all I'm trying to say is very important to maintain average normal blood pressure, and there are excellent medications available. There is no sense in complaining. We have high blood pressure. I mean, you don't have to, but then you will die prematurely. I'm sorry. I mean, what else I can say? I've done DMing, nephrology, and blood pressure, kidney and blood pressure. Okay, so I have a lady who just have a high blood pressure. She lost her kidney, young woman in 40s, just started on dialysis just because of blood pressure. I mean, but I'm talking in relation to the heart. So it's very important to manage blood pressure. Thank you.